So I think in Peutz-Jeghers syndrome, and most of the affected children have those pigmentations, the mucocutaneous pigmentation. I think it's an important diagnostic symptom, and I think the awareness is quite good in pediatricians. I think half of them are sent by, because of the mucocutaneous pigmentations, and they are half of them sent because of affected family members, and there's also children, they get a colonoscopy because of rectal bleeding, and like the polyps are found then in a obvious way or in a certain way, and so the investigation show Peutz-Jeghers polyps, and so the diagnosis is made then. We also look for anemia in any child with any problem, especially with the bowel and also with the pain, abdominal pain. And if there's a child without the diagnosis of Peutz-Jeghers syndrome, it might lead to the diagnosis as well. We don't have those children at the moment here in our treatment. They come with other, they were referred with other symptoms than anemia, but it's also a reason to look for intestinal blood loss, and then do the colonoscopy and to find maybe some polyps, and then to do the diagnosis of the polyposis syndromes, including Peutz-Jeghers. In Peutz-Jeghers patients, in the children, we focus mainly on the intestinal polyps and search for them for some in childhood at a young age, and they deal with polyps in the small intestine and also in the stomach or in the bowel and in the colon. So the most important problem is probably to detect or to find big small intestine polyps, which can cause intersubstations, or is kind of a problem the bowel has, and it's a urgent, it's like an emergency situation for the family of also for the bowel. So in a bigger small intestine polyps, we need to find them and also to treat them, and this is the reason why children get the investigation with the endoscopy, and also sometimes there's a radiocapsule endoscopy at a young age. The other polyps in the colon and the stomach, they might not have the impact on the acute problems at that time, so they get a certain surveillance and also treatment. But it's most important to find and to look for the small intestine polyps in the children. I think it's a big burden for the families. I think a little bit more than in other polyposis syndromes as well, because of the relatively young age. The children has to undergo like endoscopy, like maybe before they go to school, maybe at a younger age, and there are a lot of concerns about the investigation, the repeating every year, every 2 or 3 years, and I think also for the later problems of tumors, and so they have probably a little bit more concerns about that than other parents with chronic disease or other chronic polyposis syndromes, which all have like this risk, but it's higher in Peutz-Jeghers syndrome, I think.